Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for this show. My guest today is Crystal Collette. Crystal is the president and CEO of Planned Parenthood of the North Country, New York. Crystal, welcome to North Country Matters. It is a pleasure to have you on to talk about what an important role Planned Parenthood plays in the overall healthcare picture here in the North Country.
Thank you so much, Donna. I'm thrilled to be here and I'm excited about this conversation. It's really important.
It is. I agree. So we always ask our guests on the show to tell us something about themselves and how they came to be doing the work they're doing. You came on board as CEO here in the North Country in January. Tell us how that came about, please.
Sure. Well, I'm honored to be in this role and to be working with the team at Planned Parenthood of the North Country, New York. And like so many of our team members at Planned Parenthood, I myself have been a Planned Parenthood patient throughout my life. I have numerous stories about the ways that the care at Planned Parenthood has changed the trajectory of my own life and of those of for that of people that I love. And actually, about 80% of our staff have their own Planned Parenthood story that informs the work that they do. We're not a place that you end up working by accident. Many of us have this mission like really deep in us and see it as a core part of who we are. So I'm honored to get to do this work and to not only be a part of delivering comprehensive sexual and reproductive health care, but also advocating for access and the rights that we at Planned Parenthood stand up for.
Well, and you make a good point because people get into healthcare because they care. And they deeply believe in the fact that we all should have a right to healthcare. And sometimes the systems that we have kind of get in the way of that. But Planned Parenthood really tries to break down barriers, doesn't it?
Definitely. So we're, I think, a unique healthcare organization because we're working on those systematic barriers. We're fighting the good fight in Albany and in DC to make sure that our elected officials take action in our best interest, and we're on the ground delivering those services.
Yeah, that's right. So, as you know, the New York State Comptroller's Office just came out with a report on the state of rural health care here in New York. Several New York counties were identified as being underserved, particularly in the North Country and in the Finger Lakes, among two areas. So, let's start our conversation by telling folks about the counties that your Planned Parenthood serves and how your services fit into the larger healthcare picture across our region, because it's an important part of that healthcare picture, isn't it?
For sure. So, Planned Parenthood of the North Country, New York is one of five Planned Parenthood affiliates in New York State. And our national organization, Planned Parenthood Federation of America, supports and accredits all the affiliates in throughout the country. In the North Country, we serve six counties. So I like to say from lake to lake. Out by Lake Ontario, we are in Jefferson, St. Lawrence, and Lewis counties, and we have health centers in each of those communities. Then in the eastern side, out by Lake Champlain, uh, Clinton, Essex, and Franklin counties are served, and we have health centers in Plattsburgh, Saranac Lake, and Malone. So that's seven health centers across that huge, 135-mile trip from lake to lake. And last year we served about 14,000 patients at those seven health centers through a whole list of comprehensive services that I'm sure we'll get into at some point today.
Right, and you make a point there about just how vast the North Country region is. There are transportation barriers. There are all kinds of reasons why people have trouble getting health care across
Mm.
this region, not just sometimes because of a lack of providers. So the fact that you have seven places where people can come across those six counties is really, really important. So
Hmm.
I was reading a report several years ago that talked about how Planned Parenthood is often the only provider for reproductive health services in some places because of hospital consolidations and the general lack of providers in many rural places. And of course, more recently, we've heard about hospitals closing maternity care facilities, which create even more healthcare barriers for women. The recently passed federal budget took a hatchet to Medicaid, which has been an important source of medical funding for decades, particularly across rural areas like ours and many other places in New York and across the whole country. So, Crystal, let's talk about the impact of those Medicaid cuts on rural New York healthcare. What does that mean for people who live in rural places?
So we know the challenges of rural places that you just listed. You know, many of our rural communities face healthcare deserts where accessing primary care and reproductive and OBGYN care, like you said, is extremely challenging. People tell me stories about being on waiting lists for 6 to 8 months to get into a gynecologist, and they know that they need their PAP. And so this is really a crisis, especially for young women. For young people, not just women, but for young people, one of their primary healthcare needs are their sexual and reproductive healthcare needs. About half of our Medicaid patients that we saw last year told us that they have no other primary healthcare provider. And our clinicians in our health centers are screening for blood pressure. They're screening for anxiety and depression and providing those really basic primary care services that especially young folks might not be able to get elsewhere. The other key support that we offer at Planned Parenthood and that all Planned Parenthoods across New York State offer are really like access and navigation through the Medicaid system. So we're so lucky to be in, well, we're not lucky. We're wise in New York that we've elected folks that have supported reproductive and sexual health care and access for young people through the Family Planning Benefit Program, which is a Medicaid program that provides confidential and affordable access for people really at income levels higher than the typical Medicaid cutoff rates. Um, so all that's sort of like the basis of sexual and reproductive health care in New York State. The thing I want everyone to know is that the federal budget that passed at the beginning of July, like you said, slashed that access. Many of the Medicaid cuts won't take effect until after the midterms. And if you ask me, that was a pretty strategic move. But they came right for Planned Parenthood, as they have for decades, and eliminated our ability to bill Medicaid for these essential services. Right now, we're engaged in a federal lawsuit, and so we are currently able to bill Medicaid, but we don't know how that lawsuit's going to end up. And we've seen the Supreme Court not always make decisions that align with decades of precedent, especially, you know, in the face of this administration. So, you know, what our federal elected officials, including both of our congresswomen that represent the North Country, did is vote to take away cancer screening, these basic healthcare needs that I was describing, we offer to our Medicaid patients, um, birth control services that help people control their destiny and, you know, pursue careers and build healthy families. So I just want folks to digest that for a minute, that these really basic primary needs around our sexual and reproductive health care are being threatened and on the chopping block. At the North Country, like I said, that's about 7,000 patients last year that used Medicaid, and about $1.2 million of healthcare revenue for our small organization. Across all of New York State, we're looking at about $25 million in federal revenue that supports Planned Parenthood. And so that's a big burden for New York State to figure out how to make up that difference and keep that care flowing for New Yorkers, especially in the face of all the other Medicaid cuts.
Well, and all the other cuts, period, because that same budget slashed food help
Right.
and, you know, created barriers about having to find jobs if you're going to qualify for help. But of course, what we know up in the North Country is those jobs don't exist. It's going to be very hard for people who have a work requirement to actually fill that work requirement, plus juggle all the other things, lack of childcare. So if
And
you have
many
it,
folks on Medicaid are already working.
yeah,
They're already working. They're working 30 hours at Walmart, or they're, doing seasonal work in a restaurant. So I think it's really just a myth and a straight out lie and an attack on folks of different income levels to say that folks who are utilizing Medicaid for their care are not contributing members of our society who are paying their taxes and earning their care.
yeah, and that's a really good point to make because when you target a group of people based on income, that's discrimination. And right
Hmm.
now, that's being promulgated by the federal government against our own citizens. And
Hmm.
that's not right by any means. And you point out that, the same two congresswomen who voted against funding things like Planned Parenthood and WIC and SNAP and all the rest of it, um, they have access to all the care that they are denying everyone else. And
That's
you
right.
and you make
Yeah.
a good point as well about the people that you see. There's no place for those patients to go because they
No,
have no place to go to begin with. They've already told you that there are no primary care providers for them. So that's really important
right.
that
And
I
the
think you
care that
make
we
that point.
provide Yeah, the care that we provide is really helping folks lay the foundation of being healthy, contributing members of our societies, of being good parents and caregivers for folks as they age. So if we can't control our reproductive health, how can we fulfill all those other really important roles in our life? And I know people understand that because it informs all of our life stories, both I think people of all genders. So, at Planned Parenthood, we're used to these values-based attacks where they, come at our organization based off of abortion services or the services we offer to the transgender community. But we all know that those are just distraction techniques. That, one in actually half of all Americans of any gender have utilized Planned Parenthood for their care. People know, everyday folks know the foundational care that we provide, and that in rural communities, to your point, Donna, that safety net service is even more prominent.
It is. So I think this is a good time, Crystal, to talk about the healthcare centers that you operate and the kinds of providers that you have working for you. What can
Mhm.
someone expect when they go to one of the clinics? Who's going to see them? What kind of care can they get?
Yeah, so most of our family planning services are provided by really compassionate nurse practitioners and physician's assistants, especially in our smaller health centers like Lowville and Saranac Lake, Ogdensburg. These nurse practitioners and physician's assistants know their patients, so it's nice to see the same person over and over again. And we really, provide care to a diverse group of patients, women, men, teens. We provide menopause services. Recently, we began providing vasectomy care. So, really, a full range of care. And that we're not just a provider for folks who are underinsured or who have no insurance or Medicaid. For years, I like to brag that every pap smear I've ever gotten has been at Planned Parenthood. I've taken my private insurance to Planned Parenthood because I support the mission and I wanted to be a patient because they were there for me when I was on Medicaid. So I want your listeners to know that if they themselves or if people in their lives have commercial insurance, we certainly care for them too. And I think of Planned Parenthood as really like the expert in primary sexual and reproductive health care. So similar to how you would find a cardiologist for expert care, we're that care around family planning services.
And it can't be said often enough that reproductive health care is health care. It is not something that is not what is needed. It's needed across the board. It's needed across the lifespan. It's
Yep.
not gender related. There's not any reason to pretend that it is some kind of specialized care that we can just throw away as a society and not have a huge impact. So you make a great point about the fact that many of your clients who come to you, they may not be what the public thinks of as a Planned Parenthood client, but you really see such a huge array of people, don't you? Ages, uh, men come many, many times for your services, and that's not something that's well known, I think.
Right. We sure do. I mean, I think because we provide that really compassionate care with guidance through the system, a lot of couples come to us for their care. Parents bring their children for our care, and we help facilitate conversations between parents and kids about what's the right thing for that young person right now. We want to really engage people that are important in that young person's life. And we're really, I think, the expert at guiding some of those conversations.
And you make a good point about being able to educate young people, because we know that there's very limited sexual education available in the school system.
Mhm.
And anytime anybody wants to talk about that, many of the public kind of freeze, as if talking about it is somehow going to create a situation. In fact, if you don't talk about it, situations get created, don't they? So you're providing an essential education service as well.
Yeah, thank you. One of the neat things about Planned Parenthood is that we also have this national network behind us. And I would encourage folks to check out both our website at the North Country and our national websites for really great information around talking to youth about sex and sexuality, support for older adults around talking with other generations about issues around the full scope of sexual orientation and gender identities that our kids experience and communicate with us about today. So there's really a lot of resources out there around having healthy conversations that are values-based to help kids feel in control of their body and therefore able to process their health care decisions with adults in their lives.
Yes, and those are the most difficult conversations sometimes to have, and the most difficult decisions to make. And you don't want to make made in an uninformed way, because that leads to consequences that no one wants. So I
Right.
think you make a great point about that. So, given the crisis that we're facing in rural healthcare with these financial cuts, especially in Medicaid, what can people do to help? You have a call to action. Let's talk about how people can actually move the needle on this issue and not let the naysayers gut all of these really vital services and programs.
Yeah, we've really found that folks really want to get involved.
Mhm.
Folks need something to do with all of their energy. And so, our call to action that you mentioned right now is that we're asking folks to sign a petition to our governor here in New York State, Kathy Hochul, who's extremely supportive of us, to make sure that she continues to work with the network of Planned Parenthoods in New York State to keep our Medicaid funding whole. So, they folks can check out our website and our Facebook page for that petition. Um, if you sign the petition, it also helps you keep in touch with us so we can keep you informed about other actions that it would be helpful for you to take around communicating with elected officials. We're also really working with donors in our community to help them understand the needs that we face. Part of that work is that we're looking for folks who've utilized Planned Parenthood of the North Country for their care. Maybe they've even had Medicaid when they've come to us for their care, who are comfortable telling their story. Planned Parenthood helped me consider birth control options when I was 17, and I couldn't thank them enough. Or I needed care after I was sexually assaulted, and Planned Parenthood was there for me. Those everyday stories that we hear that so many of us have, if you're someone who's used our care who'd be willing to share your story, again, head to our website, fill out our storyteller link, and we're using your stories to help our donors and to help politicians understand the urgent need for funding for these services to continue. Um, Almost most importantly, Donna, what I would ask folks to do is to just start conversations. So, you're out with friends for coffee, or you catch up with somebody that you haven't seen in a while. Talk to them about what you learned today. That Planned Parenthood is an essential healthcare provider, especially in our rural community, and that the federal government's coming for half of our revenue. Start those conversations, and you will be surprised how many people are completely supportive of our mission and are outraged and didn't know that these attacks are underway. So that sort of community dialogue is almost the most important thing that folks can do right now.
Yeah, you make a good point about the power of the personal story because you can give facts and statistics and until you're blue in the face, but they don't make an emotional connection the
Mm.
way someone's personal story does, whether you're talking to just people out in the community or whether you're talking to politicians. They can sometimes be very divorced from the reality on the ground of what people in their districts are facing. And so I think those personal stories are very powerful and they're a great tool. You know, one of the kind of under sung things that you folks do is the cancer screenings and how
Mhm.
important those are because it's so hard to get into. You're not quite sure if you have a problem, but you need to be seen, and then you'll make an appointment. Well, we'll see you in 6 months. Well, 6 months is can be a death sentence for someone if they
Right.
can't get the help they need to be screened immediately. Isn't that true?
Definitely, Donna. This is care that can't wait. If you feel a lump in your breast or you're concerned, you know you need regular cancer screenings because of your family history or your medical past. You cannot be on a waiting list. If you need emergency contraception, you need it today. If you're having symptoms from an STI, you need care today. You don't want to delay that care and end up in an emergency room. So I think that your listeners understand that. And I agree with you. It's those personal stories that folks can relate to that sort of take the politics out of it. Maybe I'm wishful thinking here, but they take the politics out of it. It's about real people who just need health care. It's that simple. And so, are we really going to continue to let our federal government come for that care, or are we going to tell our stories and stand up for access?
You know, I recall when President Obama was in office and he got the Affordable Care Act passed, and the other side screamed that all we would have is rationing of care. Well, the other side is in power now, and we're seeing the rationing of care happen right on the ground in all kinds of communities, big, small, across the country. That is not what a first world nation does.
Right.
Healthcare is a right and it's a responsibility of government to provide, isn't it?
Definitely. And we know how, especially in rural communities, how integrated our healthcare system has to be to function well. So we're already on the brink of not of a crisis. I would say we're in a crisis, right? We have long waits in our emergency rooms. Folks are waiting for mental health and substance abuse treatment that they can't get in our community. Folks are traveling an hour and a half to deliver babies. Are we really going to stress this system even more where our older adults don't have access to nursing homes and caregiving in their homes, where young people who need sexual health care cannot access that care at all and then are facing unintended pregnancies or sexually transmitted infections and diseases that they can't receive care for? Is that the type of community we want? I know it's not. And I think that we are on this, turn at this turning point in our nation, but especially here in New York around how we want healthcare to look.
Well, I'll tell you that one of the things that has come clear to me in the last several months is that systems that took decades to build up and to really have a rich support system have been gutted practically overnight. And healthcare cannot be gutted any more than it already is because we're just waiting for the next COVID to come
Hmm.
along. And we should have learned that lesson, 5 years ago, that you have to have a robust healthcare system when something unexpected happens that is a national or in that case an international crisis. And
Yes.
those things are out there waiting to happen.
Hmm. Right. Right.
Crystal, thank you so much for coming in today and for our conversation. I hope you'll come back to North Country Matters with additional information and more details about your services. You had mentioned you've identified several people willing to tell their story about how Planned Parenthood has impacted them in their health care. I think we all have a lot to learn from those stories, and I would be very happy to share some of those stories with people willing to have a conversation in public about that.
Excellent, Donna. I'll set that up, and I can't thank you enough for having me with you today to talk about the care that we provide. We've been delivering this care in the North Country for decades, and despite all of these threats, I want folks to know that we're a strong movement and a strong organization, and will continue to be here for the North
Well,
Country.
the history of Planned Parenthood, which would make a great program in and of itself, is one of resilience and persistence. And so you're not going anywhere, that's for sure.
No,
So it's been a great conversation. I thank you so much, not only for coming in today, but for the work you're doing and the fact that you are leading here in the North Country on such an important issue. So we will definitely have you back.
thanks, Donna. I'll look forward to it.
You're very welcome. I want to remind our viewers that these conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters.